When it comes to healthcare, information isn't just data. It can literally be the difference between a correct diagnosis and a huge mistake. Getting the right knowledge at the right time, that's what saves lives. But what happens when that knowledge is locked away? Totally impossible to find when you need it most. This picture of a chaotic desk, it just perfectly sums it up, doesn't it? This is the reality in so many hospitals and clinics. All this critical information is buried under a mountain of documents, random spreadsheets, and systems that feel like they're from another decade. For doctors and nurses, trying to navigate this chaos is a daily race against the clock. So, there's actually a name for this whole mess: the knowledge crisis. And just like any medical condition, it has a really clear set of symptoms that are just dragging down how well we can care for patients. First up, you've got disconnected knowledge. Think about it. The clinical protocols are in some PDF over here, patient FAQs are on a website somewhere else, and the data on drug interactions, that's in a completely separate database. Nothing talks to each other. It forces the staff to become detectives just to do their jobs. And what happens next? Well, that leads to a rising support load. Just imagine the nurses and the admin staff who spend hours every single day answering the exact same questions from patients and even from their own colleagues. It's not just inefficient, it's a huge drain on resources that should be going directly to patient care. And, all of this just snowballs into massively inefficient operations. When you're relying on doing things by hand in such a high-stakes environment, the risk of delays and human error just shoots through the roof. And in a field where seconds can literally save a life, that is a risk nobody can afford to take. And this quote, man, it just hits the nail on the head. It really captures the scale of the problem. We're not talking about one department or one hospital. This is a systemic issue facing the entire healthcare sector, and it leads to burnout and people leaving their jobs. So the big question is, how do we fix it? Okay, so we've diagnosed the illness. Now it's time to look at the prescription. And that is a platform called Batsa, which was created by Indica AI to tackle this knowledge crisis head on. Now, what I love about this is the phrase inert knowledge. Just think about all those training manuals, clinical guidelines, and policy documents just sitting on a server or in a binder somewhere. They're static, they're lifeless. What Batsa does is it takes all of that stuff and turns it into a dynamic, conversational expert that you can ask questions to 24/7. So that's the big idea. But how does a technology like this actually get put to work inside the super complex world of a hospital or a clinic? How does it deliver a real diagnosis for all those operational headaches? Well, it's actually a surprisingly simple four-step process. First, it securely ingests and centralizes all that scattered information. Second, your team can build their own custom AI bots without writing a single line of code. Third, you deploy these assistants wherever they're needed most. And finally, you govern them. You monitor how they're doing and make sure everything stays secure and compliant. And this is where you see the real-world impact. Knowledge centralization means a doctor gets an instant, reliable answer on a clinical protocol. Support optimization means a patient can find out about visiting hours at 2 in the morning without having to wake up a nurse. And skill development means a brand new hire can learn procedures through an interactive AI tutor instead of just reading a boring old document. So what does this actually look like in action? Well, on the left, you can see a simple, clean AI assistant doing its thing. And this tech is already being used by companies like Parcha AI, which is a health tech innovator that's really focused on improving clinical decision support. And hey, you don't have to take my word for it. Here's a direct quote from Parcha AI's Chief Medical Officer, Dr. Samia Rawat. She called the partnership transformative and said it elevated their clinical decision support system. Now, that is some powerful validation coming straight from a medical professional on the front lines. And look, this isn't just about launching one bot and calling it a day. What you're seeing here is the back-end control panel. A hospital could have one bot just for patient billing questions, another for internal IT support, and a third super specialized bot for surgical pre-op checklists. And they can manage them all from one central secure hub. All right, so we've covered what it is and how it works. Let's dig into the final piece: the hard data and the kind of enterprise-level features that make this a trusted solution for an industry as sensitive as healthcare. Let's just start with a number. This isn't some theoretical product or a cool idea on a slide. We're talking over 120 active enterprise deployments. This is a proven, scalable platform that organizations are relying on right now, today. Okay, so this chart might look like it's for general business, but let's translate it for a hospital setting. Customer support, that's really patient support, automating FAQs and answering questions about appointments.
HR and learning, that's for onboarding new nurses or continuous training on new equipment. And IT and operations is about giving staff instant access to internal tech procedures. The versatility here is absolutely key.
When you're talking about a big healthcare system, it really boils down to these three things, right? You need AI automation to cut down on manual errors. You need a no-code interface so the head of a clinical department can actually build a tool, not just the IT team. And, probably most importantly, you need enterprise-grade security. That's just non-negotiable when you're dealing with patient data. I mean, the difference here is just night and day. On one side, you have your standard operations, fragmented, manual, and slow. And on the other, powered by Batsa, you have a centralized, automated, and instant system. It's really the shift from searching for a needle in a haystack to just asking the haystack where the needle is.
And look, if you had any lingering doubts about security, this right here should put them to bed. Indica AI's partnership with a global giant like Samsung is focused specifically on health AI. We're talking about enabling the secure processing, anonymization, and annotation of really sensitive medical data, like prescriptions and lab reports.
So, let's just end on this thought, this question, really. What could healthcare achieve if its greatest asset, all that knowledge, was always right there at its fingertips? Just imagine a world with faster diagnoses, better patient outcomes, and a whole lot less burnout for the heroes working on the front lines. That's the real promise here, transforming healthcare, not with a new drug, but with a completely new way of knowing.